This is not acceptable. My aunt is not on her oxygen.
Okay. First of all,
I am a nurse and I know what I'm talking about.
You're a nurse, right?
Yes.
Okay. This is your aunt. Do you know what your aunt has?
What she has is no oxygen on right now.
Ask you that part. I asked you, do you know what she's diagnosed with?
It's something with a CPD something. CP something.
Okay. Do you know what COPD stand for?
Why are you asking me all these questions? You should be trying to put her on oxygen.
So COPD stands for chronic obstructive pulmonary disease, okay? Do you see that little number on the vital signs machine right there? What does it say?
It says 92%.
Perfect, 92%. So based on the doctor's order, 92% is sufficient.
No,
for
she's
her.
supposed to be at 98%.
Do you understand why it's not good to give her too much oxygen? Why it shouldn't be at 98%?
Why are you asking me all these questions? Just put her back on oxygen.
Okay, she don't need any oxygen right now. She's perfectly on room air. She's saturated 92%. I'm not trying to disrespect. So what specialty or nurse you like are you?
I'm a medical assistant at an office.
Okay, so you're not a nurse. Okay. Hey y'all, welcome to my channel. It's your boy, Nurse Jumpin' Jackson. If you're new here, I'm a nurse who shares real stories from bedside, stuff they don't teach you in nursing school, mixed with a little humor and a lot of truth. If you ever worked in healthcare, you already know the patients are one thing, but the family members, baby, they come with their own set of policies.
Yeah, I'm hearing this and I want to hear this.
If you want more stories, don't forget to subscribe and click that bell to get all the new content that I create. Let me tell you about this time I got cussed out and reported, all because I refused to put the patient on oxygen. A patient who has COPD. Yeah, you heard me right. It was a busy morning shift, the kind where the coffee don't even hit because the call bells rings before your badge even clocks in. My patient, a sweet elderly woman with advanced COPD, was admitted for shortness of breath. Now, as you and any nurse knows, you got to be very careful with oxygen and COPD patients. You can't just slap on oxygen. She was sat in a normal range. We had RT on board. Orders was tight and was stable. She was stable, 92%. Enter the daughter, the granddaughter. Dun 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 dun. So the granddaughter storms into the room. Before I can even introduce myself, she says, "Why does she not have oxygen on? She can't breathe." I calmly explained, "Ma'am, she has COPD. Her normal saturation is in the high 80s, low 90s. Putting her on more O2 could do more harm than good." Then she hits me with, "Well, I'm a nurse. I know what I'm talking about. Just put it on." The family is trying to override the respiratory therapist and the doctor orders. WTF. You know what? What the fuck? I said, with all due respect, I have to follow the medical plan and protect your grandmother's, auntie's safety. But I can absolutely update the doctor if you're concerned. Y'all, this girl rolled her eyes so hard I thought she was going into a seizure. 10 minutes later, I'm at the nurse's station documenting, and here comes the charge nurse. "Hey, can you come into the manager's office? We got a report from a family member." So I walked in, boom, there's a voicemail transcription from the same granddaughter. She says, "I was rude, unprofessional, refused care," and get this, "he endangered my grandmother and refused to give her basic oxygen." Then she called me aggressive and intimidating. Y'all already know what's that code for, especially being a black man. And remember, when she said she was a nurse, HR checked, she wasn't even in the system. She lied. Lied.
None of it's true.
None of it's true. None of it's true. It's BS. They made it up. They lie.
Loud and wrong. She was actually a medical assistant at an outpatient abortion clinic.
What?
So I had to defend myself. I had to defend my license over someone's ego and misinformation. Luckily, my charting was tight and I had every interaction documented. RT had co-signed the orders and even the doctor backed me up. The complaint was tossed, but the stress still very much real. So the moral of the story, document everything. Don't let family members bully you into unsafe care. And just because someone says they're in healthcare doesn't mean they know what's best for your patient. This is a I'm gonna get you fired kind of energy, kind of job. People are out there to try to get you, sue you. do whatever they can. And so you really got to document and really protect your shit, because I just couldn't believe like something like this would happen. I'm like, I'm a nurse, and you lied about being a nurse, and you want me to do something that was out of scope of whatever practice you think you are in, just so I can harm your loved one. That's crazy. So these are some of the stuff that nurses have to go through on the ongoing basis with family members, and our license is always on a freaking table with some bullshit like that. Anyways, if you like my content, be sure to, like I said, subscribe, share, and also comment below some maybe some experiences other healthcare professionals, I'm not sure who's watching this, may have had or come across, because have patience for us nurses, because we go through a lot of bullshit. Have a good day.